Good oral hygiene is essential for healthy teeth and gums. The following information will show you how to care for your teeth and gums whilst wearing fixed braces and ultimately achieve the best possible results. When your braces are fitted, they're going to feel a bit strange to start with, and your teeth may feel quite tender for the first 2 or 3 days. You may want to take some mild painkillers for this. Your teeth may feel quite mobile, so it's a good idea to eat really soft foods for the next few days until your teeth are used to the braces. Allowing plaque and food to collect around the teeth and brace can cause puffy gums and tooth decay, so you must brush your teeth at least 3 times a day, preferably after meals and before you go to bed at night. If you play a contact sport like hockey or rugby, we can supply you with a specially designed mouth guard which will protect your teeth and braces from injury. These can also easily be remoulded as your teeth straighten. If you play a wind instrument such as the flute or a brass instrument, it may take several weeks for you to adapt to playing the instrument with the brace in your mouth. Now we'll take you through your care pack.
Now you have your braces stuck onto your teeth, it's very important that you keep your teeth, your braces and your gums thoroughly clean. Braces consist of little brackets stuck onto your teeth with a wire that runs through them. I'm now going to run through your Vitis Healthcare pack. It will have everything that you'll need to look after your braces through treatment. In your pack there's a mouthwash and toothpaste. They've been specifically formulated for patients with braces. They have 4 key components: CPC, an antibacterial agent that helps prevent the formation of dental plaque; fluoride, to remineralise tooth enamel and prevent tooth decay; allotonin, to repair tissue damage caused by the rubbing of the brace; and aloe vera, to help soothe the gums and help heal small lesions. Now you have your braces on your teeth, I'm going to go through toothbrushing. We start off with an ordinary toothbrush which has a V-shaped slot in it. We need to work the bristles gently but thoroughly into the gums all the way around. Once you've brushed all the surfaces of your gums, you start brushing all the surfaces of the brackets. Start off wiggling the bristles along the tops of the brackets, along the sides of the brackets and underneath the brackets. And then do exactly the same on the bottom teeth, working the bristles into the bottoms of the gums, underneath the brackets, side of the brackets and on top of the brackets. We then move on to a little single tufted toothbrush. This does exactly the same thing, working the bristles up into the gums and all around all the surfaces of the brackets, getting underneath the wires. There is also a little interdental toothbrush. It's a 2-tone toothbrush. The black area shows any plaque that's on your teeth, and the white area that shows any bleeding. This is used underneath the wire. So used in the middle, side of the bracket, side of the bracket, in the middle, side of the bracket, side of the bracket, all the way around, and exactly the same on the lower teeth. For patients with lingual braces, cleaning will be a lot more challenging. You still need to use all the brushes that we've discussed earlier, and especially using the interdental brush that will go underneath the wire. It has a long handle which makes access a lot easier. We also have a 2-minute timer. This needs to be turned over a couple of times, so it's spending at least 6 minutes brushing your teeth. We've also got some disclosing tablets. This is just food colour. You break 1 tablet up, chew it around your mouth for 1 minute and then spit it out. Have a rinse and spit out. Look in the mirror and you should see if there's any old plaque or new plaque. The darker the colour is, the longer it's been there. Your brackets are going to rub against your lips and cheeks. So in the kit is some wax. This wax will help ease any discomfort. All you need to do is break a tiny little bit off, roll it into a ball, make it all soft and pliable, and then mould it around the bracket that is rubbing. You should only need the wax for the first week. After that your lips have hardened up and you shouldn't need it anymore. But it's always a good idea to carry 1 little pack with you. The toothpaste is quite fluid in texture and so helps flow between the teeth and the brackets. The fluoride mouth rinse, you take 1 teaspoonful, swish it around your mouth for 30 seconds and then spit it out. It's best done at night time before you go to bed, and then you're not going to eat or drink anything afterwards. Both the toothpaste and the mouthwash have an appley mint flavour. These brackets are stuck on very gently onto your teeth, which means that you can't bite into anything hard, sticky or chewy throughout treatment. So you must avoid things like apples, pears, crusty rolls, French bread, corn on the cob, pencils, rulers, fingernails, all have to be avoided throughout treatment. You can have an apple, but it has to be cut up into tiny little pieces, or a carrot can be grated. So if it can't be minced, mashed, chopped, it has to be avoided. Try and keep sweets and fizzy drinks to a minimum. If you're going to have sweets, have them once a week. If you're going to have fizzy drinks, drink them through a straw. That way they'll go straight down without touching your teeth. If you break your brace, don't worry, it's not an emergency. Ring up, make an appointment and we'll fit you into our first repair slot. If it is rubbing, then use your wax to get you out of discomfort until we can see you. Over the next day or two, you may find that you're in some discomfort, so take whatever painkiller you would normally take for a headache. Everything I've gone through will be in the information leaflet, so good luck!
After 3 days, they just stop aching and you get used to them.
Just after my braces were fitted, my mouth was really tender. I used the wax that they give you, and within 3 days my mouth had adjusted and it felt fine.
From what I've heard from other people, it sounded so much worse than what it actually was, and it's actually fine, and they only ached for a couple of hours.
After my braces were fitted, I did notice they were there and they were quite painful, but again, after a few weeks or so, you get used to them and they're absolutely fine.
The best things to avoid when you first have your braces on are going to be things like steak, toffee, any sort of really chewy sweets that could irritate the brace, and fizzy drinks.
There are some foods that are difficult to eat, like toffee, pizza, apples.
Just stay away from hard sweets and chewy sweets and chewing gum and stuff, or all sweets.
It's quite hard to eat rice because whenever you eat rice or things like small, they get stuck in your brace and it's not very pretty.
Whenever I go out to eat, in restaurants, in fact even at home, I always have toothpicks with me.
And you have to carry around a little mirror so then you can make sure you get it all out.
Actually biting an apple when you've got top and bottom brace on is near on impossible. So you cut them into little cubes instead and eat them. So you can still eat all the things you want to eat, but you just have to maybe try them a different way. Looking after your braces when you first have them on is fine. You just have to do a few different things when you're cleaning them.
At the beginning it was quite hard to remember, but after a while you do get used to it.
It doesn't take extra long time to brush them, or it's just maybe a minute longer than what it's like without braces.
I find it easy to keep my braces clean because I use the timer.
Just maybe an extra couple of minutes in the morning and an extra couple of minutes in the evening, but that soon became second nature, so it didn't matter.
With disclosing tablets, they're really easy to use. You just put one in your mouth, wash it around for a bit, and then they stick to the plaque in your mouth.
When you use them, it means that you know where you've got to brush more.
And then after a few days of working on those areas, you don't necessarily need to use them.
No, the cleaning regime is not a big issue.
You just got to do it right for like a year or two, and then your teeth are good and you don't have to do it ever again. And it's just so worth it.
It's important to continue to see your general dentist for checkups whilst you're wearing your braces. If you damage your brace, contact your total orthodontics practice as soon as possible. Don't wait until your next appointment. If you experience problems and require out-of-hours advice, please call this number.